Go there.
Hi, my name's Brooke. I'm going to be your nurse today. I'm going to wash my hands. I'm going to be doing a head-to-toe assessment. We're going to look at your eyes, your ears, your nose, your mouth, your chest. I'm going to listen to your heart sounds and your lung sounds and your abdomen. Can you tell me your name and your date of birth?
Bonnie Jones, June 1st, 1970.
Can you tell me where you are right now?
Cleveland, Tennessee at the doctor's office.
And can you tell me what year it is?
2017.
Patient is awake. She's fully alert and oriented ×3. Do you have any questions before we begin?
No.
I'm going to start by checking your blood pressure. Is your right arm okay?
Yes.
Blood pressure is 110/68 while the patient is sitting. Alright, I'm going to check your skin on your arms and on your legs with the back of my hands. You can straighten your legs out for me. Okay. Skin is warm, it's dry, and it's intact. There is no lesions on the arms or the legs. I'm going to look at your nails now. All nail beds are present. No deformities noted. Capillary refill is less than 2. Okay. Now what I'm going to do is I'm going to pinch some skin right here under your chest. We're going to check for the skin turgor. Skin is elastic, no tinting noted. So that just checks to make sure that you're not dehydrated. Alright, so I'm going to look at your eyes. So what I need you to do is I'm going to have you look off into a distance, and I'm going to shine a light into your eyes.
Glasses on or off?
You can take them off if you don't mind. Okay, so I'm just going to look at your eye. Just look straight ahead. Okay, and a bright light. Alright. So what I'm going to have you do is I'm going to have you to stare off into the space, and I'm going to hold my finger in front of your face just about 3 inches away to make sure your eyes do accommodate. Pupils are perla. They are round, equal, reactive to light, and they accommodate normally. Now I'm going to look in your mouth. I can have you stick your tongue out and say ah, ah. Okay, if you can pull your bottom lip down for me. Okay. Mucous membranes are pink, moist, no lesions. Teeth are in normal condition. And now we're going to move on to your ears. Alright, so we're going to pull the pin down and back. Insert. Tympanic membrane is present. Light reflex is present. They're normal. It's pearly white. Light reflex is normal on the left ear. Tympanic membrane is present. It's pearly white. Any difficulty whenever I pulled on your ears?
No.
Okay. The ears are pink. There's no drainage, no tenderness, no swelling. Alright, so now I'm going to check your pulses in your wrist. It's the radial pulse. Pulses are a +2, present bilaterally. Okay. And now I'm going to check your dorsalis pedis pulses. Dorsalis pedis pulses are present, +2. Now I'm going to check for periedema in your bilateral extremities. So I'm going to push for 5 seconds and release. No edema noted to the bilateral extremities. And I'm just gonna wash my hands again. Okay. So, I am going to check your lymph nodes in your neck and then behind your ears. Any difficulty when I press?
No.
Okay. There is no swelling in her lymph nodes, no tenderness, no drainage, no lesions. Okay. So now what I'm going to do is I'm going to move on and I'm going to listen to your heart. So I'm going to have you lay down. You can go ahead and lay back for me. So what I'm going to do is I'm going to start by listening with my diaphragm. And we are going to, I'm going to look whenever you take a breath. There's no heaves, no lifts. I'm going to palpate. There's no deformities, any tenderness, no tenderness, no lesions. Okay, and now I'm going to listen. So, second intercostal space and listen. Move over. The left sternal border, the third to fourth hip space. Go over again. I'm going to go to the mid-clavicular line. I'll lift your shirt up, keeping you covered. Alright. I'll listen to the fourth heart sound again. Okay. I'm going to move down to the apex and listen for 1 full minute to get your heart ready. Okay, now I'm going to flip it over to the bell, which is a smaller part of my stethoscope, and start listening at mid sternal border. I'm going to go to the left sternal border, to the right. Okay, I'm going to cover you back up. Last one. Alright, your heart rate is 63. It is regular. There is no splitting sounds, no extra sounds noted. And now I'm going to listen to your lungs. So if you can sit back up for me for just a minute. Okay, so what I'm going to do is I'm just going to measure your anterior and posterior. What we're looking for is to make sure that it is not as wide as the front, and it is normal. So if it was abnormal, that would mean you were kind of barrel chested, possibly have COPD or anything like that. So I have to listen 6 spots on the front, 6 to 8 spots on the back, and 1 under your right arm. So I'm going to place the stethoscope and have you take a deep breath at each place. And I am going to start at the top. If you can take a deep breath. Again. Okay. And we're going to cover it up. And I'm going to go under your shirt. Okay, deep breath. Okay. That's 4. Got 2 more. Okay, deep breath. That's 5. 1 more. Okay. Now if I can have you to turn to face the camera just a little bit, that way we can listen to your back. Yep, that way.
I'll turn this way.
No, face. Okay. Alright, so again, 6 to 8 times. Deep breath. Okay. And deep breath. Okay. Deep breath. Deep breath. Okay. And again. Okay. I'll raise your shirt up to listen 2 more times. Deep breath. Okay. And last time. Okay. Now if I can have you turn back forward, and I'm going to get you to raise your right arm. And I'm going to listen. Alright, and a deep breath. Okay. All lung sounds are present in all fields. They are regular. Respirations are 16, unlabored, no obvious distress observed, no shortness of breath, any difficulty when you take a deep breath. No difficulty when patient takes a deep breath. Lung sounds are clear. There is no crackles, no wheezing, no rails noted. And now we're going to move on to your abdomen. If you can lay back down for me. Alright, so I'm going to raise it up and look at your belly. Alright, so we always look before we touch or listen. So there is no lesions, there's no heaves present, no deformities. The skin is pink, it's normal for race. Alright. And now I'm going to listen in all 4 of your quadrants, okay? Vowel sounds are present. They are normal. There is no other sounds noted in the abdomen. And now I'm going to palpate your belly. You just tell me if there's any tenderness whenever I push. I'm going to do light palpation first with just one hand. Right now I'm just feeling to see if there's any masses or abnormalities. Any tenderness when I push?
No.
No tenderness, no masses, no deformities. Alright, and now I'm going to use 2 hands to see if I can feel your organs. Any pain?
No.
No pain on palpation. Skin is warm, it's dry, it's intact. No masses, no tenderness, no lesions. Okay, and now I'm going to have you to sit up for me. And what I'm going to do is I'm going to have you squeeze my hands. I'm going to check your strength in your hands. Alright, So strength is normal. It is a +2. I'm going to have the same in your feet, so I'm going to have you push down like you're driving a car. Okay, and pull up. Strength is a +2. I'm going to use some hand sanitizer. Okay, so now I'm going to have you stand up and I'm going to look at your spine. So if you can just have your back face the camera. Okay. So now I'm going to look at your spine and I'm going to unrub it for just a minute. And I'm just going to feel down. There's no masses, no scoliosis. No kyphoidosis noted. Any tenderness when I push?
No.
Okay, and if you can bend down for me. Touch your toes. Spine is normal. No tenderness. Okay, you can stand back up. No scoliosis. And sit back down for me. Alright, so the plantar flexion was present bilaterally. It was a +5. The hand grips were equal bilaterally. It was a +5. Do you have any questions for me before? Alright, so I did not find any abnormalities that need to be checked with your doctor. I don't see the point in you following up with a primary care doctor unless you just go for your normal checkup. As long as you don't have any questions, I want to thank you for allowing me to do this head-to-toe assessment on you. And I hope you enjoy the rest of your day. And this concludes my head-to-toe assessment.